Morning, good afternoon, and good evening. Welcome to the 1012th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's English edition with a silent prayer for 1 minute. Thank you. Today we have with us Dr. T.N. SREEDHARA KURUP, the former Assistant Director, Central Council for Research in Homeopathy. Wonderful personality. We witnessed a nice presentation just a few minutes back from a young lady doctor in Hindi, and now one of the senior most person in English. Well, all this indicates the possibilities and the speciality and the potential of homeopathy. Both these fellows can work wonderfully with homeopathy. That is the speciality because it is evergreen. So on behalf of IFPH, I welcome SREEDHARA KURUP, sir. Please proceed, sir. The topic is an hour with SREEDHARA KURUP. So those who would like to participate can ask some questions or can have some discussions. Sir, please proceed, sir.
Yes, today's my main subject, because I may not, first of all, I like to thank the organizers of IFPH and give me this. And also, I also thank to the senior most members who are attending here and all the members IFPH, that the students, teachers, and the lovers also. I like to all the persons who are attending, I give my big salute for you all. First of all, I like to say that the thanks to our Almighty and our Master Penman. And also I remember all my teachers for to teach me in this much, and my advisors also. Then let me start today's my subject, learning disability. Nowadays, there are so many cases are coming with learning disability. Why I selected? Now also I am a student, I am not a teacher. So recently I appeared one examination about 1 month back. Then one of my friend was telling I was not able to finish all the questions. He was well versed than me, but he was not able to finish that exam because of so many other reasons also. But I know, but that learning disabilities nowadays, it is a big problem among to the students. But that also due to so many. Anyway, I may not get the time. That is why I few cases I will present, and then I will go to the sporadic backwardness and the learning disability, how it is, what are the ways and what are the methods other than the medicines also, how you can diagnose, and all these things we can go for next. First, that case, a 13-year male child, only one boy, no siblings, came for consultation. Learning disability treated with a psychologist and psychiatrist last 2-3 years, but no relief. He failed in all subjects. He was in 6th standard. Father is at abroad and mother is a housewife. Signs and symptoms: kidney patient, sadness and depression because of he is failing. That is why he is worrying always. Inability to think while writing and reading, and he is forgetting what he is reading. He is studying but cannot remember the things. In the examination, he will enter, he will forget everything. Music, because his one of his main symptom was whenever the music is, he cannot remain there. He will sometimes he is crying also.
Excuse me, sir. Do you have screen sharing?
No. Screen sharing is there. It is in the nest only, not in the case.
Okay, yes, sir.
It is not there because I couldn't get the time.
Yeah.
Yesterday night only I got to the information, so I couldn't prepare it.
Okay.
He is so much religious. He is, but the bhajans is irritating. Whenever there is a bhajan, he will leave from to the place. Anxiety and fear for thunderstorm, exhaustion after reading or writing, aversion to milk. He may take the milk, then immediately he was milk products, he will get some problems. He he read much but cannot repeat the things in the examination. Better my movement, headache, aggravation by exertion, and exposure to sun, and occipital pain, aggravation by reading. All these things, with these all symptoms, I prescribed Natankar in totality. It came by repetization with the help of that the different repetization that I prescribed Natankar, and also along with the comparative study with the Metia Medicas that I prescribed Natankar 0/3. It is within about 1 month. It is completely, he was started improving, and within 6 months, he passed with good marks. Now he is studying in very well, and there is no difficulty for learning. So the learning difficulty, we can cure so many cases. Not only with that, there are some other methods also there, but more than that, along with our medicines will give, the result will be double, and then we will get very, very good effect. And we are having wonderful remedies for remembering the things and so many other problems also in learning disabilities. Second case, a female child about 17 years studying 11th standard, and she was suffering from backwardness in studies. One day, she was having some depressed because of that, some disappointment in love, not in one, 2 times. She was having relation with some friends and that boyfriends. So after that, she lost that friendship. After that, she started all these things. Forgetfulness, she is reading but cannot remember the thing. She is so much worries and disappointment about her these incidents. Suddenly, someone asked her name. She cannot remember even her name. And also the spelling mistake is maximum. Weeping when someone asks to someone, without weeping, she cannot say. Even Parsatra and Ilium is there, but still I am telling only that anticipatory anxiety was irritated. Whether it is speed is high, Manoj, whether speed is very high or whether I must have to go slow.
No, sir. No, sir.
Okay.
Absolutely right.
Anticipatory anxiety, irritated, and because anything she wants to do it, she will go half an hour back and she will wait for there, because she feels she is incapable of doing the things. Hurry, worry is the problem for her. Burning in head and feet was there. Then menses, metrorrhagia and memorrhagia. There is irregular menses. You cannot say when it is coming and when it is disappearing. So that is another problem. Craving for pickles and sweets. Backache, better by passing urine. Even lycopodium is also having that same symptom, but that I give another medicine. Occasional by she was lying on when she is having some, occasionally she is getting breathlessness with cough, but when she may lie on Nietzsche's position, she will get good result. Or complaints aggravation during daytime. Better when she may be go to seashore. Sometimes she may go to the seaside, then she will feel far better. Outpatient, open air also gives relief. Medoranum 0/3 cured her completely within 3 months itself. That is the, and also I give for Natramor 6x as a placebo. but she got very good relief and getting good marks also. Then third case, 10 years baby. Why I am telling first that the case, sometimes the last moment when the time may be finished, that I may not be able to explain the cases and present the cases. That is why I am telling the first itself. Then third case, a 10-year boy studying in the 5th standard started, brought for the consultation, failed in the 5th standard in all subject. And he was having a history of suppression of skin disease, heart patient, weakness of the memory, very selfish, not getting proper, he was not clean and neat, craving for sweets, sulfur 0/3, and carnivore 6X was given 2 to 2 tablets, morning, afternoon 9 hours, just like that of placebo only, but it is also completely cured. The fourth case, another case, 16-year boy was in SRC. First he was came, and in that case also, he was in his childhood, it was treated by these things, and he was also not in good in studies, but now he got a very good job, and because he was prescribed that also Medorna and Gingabylam. That these are the cases. If whether you like to take to the case or that I like to be learning disability, I like to give and say about learning disability some of the points. Will you please share the slide? Or
Yes.
please.
If I can be made co-host, please.
Yes, yes.
Pardon?
He is sharing some.
Sandeep, who is sharing?
Sandeep.
Yes, he is co-host. He can share.
Can you see my screen, please?
Yes, of course. No problem.
So I thank Dr. Sandeep to prepare these slides immediately within short period. Thank you very much, because he prepared for me. Thank you very much.
Kurup sir, you can see my slide, no?
Yes, I can see. Everyone is able to see or not? Ask.
Yes, no problem. Please proceed.
Why I am doing, so many people are having problem for study skills. That is why deviation from the aimed study skills can lead to a scholastic backwardness. Children with learning disabilities will find it extremely difficult to follow the appropriate right set of study skills. Let us discuss what is the appropriate study skills. One is planning. Please take the first.
Yes.
First is planning. First, the child must be able to plan the following: time, portion, organization, learning pattern, priority. You have to train the child with learning disability in these things. He should be able to think for himself about choosing to the factors for the time structure. What is the time available for studying? How can I use it in different ways? All these things are important. That is the planning. Second one is organization. Whether it is speedy or whether you can follow.
Yes, now it is quite speedy, sir.
Yes, then I can go to little slow. Organizing. Second point is organizing. The organizing, the time structure is decided to the next important step is to organize studying tools and information. Studying tools means we must have to get to the books and notes, etc. We must have to organize and come under this category. Do not forget. And also the curriculum, and that we must have to understand what are the portions we must have to cover, what may be the things that all we must have to collect, whether what is the plan up to the, whether any project work, whether we are having that, what are the portions to cover, curriculum and etc., syllabus, etc., we must have to understand. That is organizing. 3, analyzing. What is the analysis? The analysis is that children with learning disabilities cannot grasp information without analyzing it. They can never mug up. Analyzing leads to comprehension. Therefore, subjects should be associated with life, and these children should have the ability to analyze each subject systematically, uniformly. That is the analysis. Learning disability can be grasped information without any analyzing it. They can never muck up. Analyzing leads to comprehension. Then the next one is the directing. Scientific facts, hypothesis, universal statement, all such knowledge that is abstract pose a challenge to the child with learning disability. The skill of directing hence become extremely important in helping him understanding abstract theories, essays, and theses, etc. Then comes to the procedure pattern. Knowledge, the right procedure to study, also the study skill. What is suits the most, learning by writing or learning and writing? Sometimes some persons will read and they can understand, but some people, they must have to write the things, then only it can be. There is different methods are there. That is the method of survey, questions and read, recite and review. If sometimes we must have to, or what I usually do is, I may read and then I will think to the points and I rewrite and rewrite. If some points are missing, again I may learn and then I see and the answer, how many points are there, that points, then I will elaborate. There are different methods. Some persons may read in the night, some persons may read in the daytime, or some persons in early morning, some persons can anytime, different times that it is suits for each and every person. Coordination. Detailed coordination is an important factor in study skill. For instance, what are the skills required to explain a project to child? What he is able to coordinate the information given. How to coordinate the things that we must have to learn. What are the requirements? Here the best alternative modeling method. The teacher or parent has taken up to the task of teaching the child to, from the beginning, demonstrate the right method of learning and doing to the child gradually. We must think only the children who are not learning properly. That standard the teacher must have to teach. That way it must, some people can understand by reading, some people can understand by hearing, some people can understand by both only. So in what it is that they must have to understand that their own way. They must have to, nowadays that the visual aids are using, that is more, some persons were more interested in such visual aids that they like to more, they are depending upon that. 7, relating. This skill is required to connect new information to the old and restore it in memory, thereby creating cumulative information. The child must not be made to be by heart information in segments. He should be taught to collect them on his own words. He must not bub like that, bubble. Must not to be learned. You must understand what is the subject and understand the things, and your own words you must have to write. That is the most important, relating that the things in your mind and relating that. Then next one is reporting. Reporting is required when the child needs to recollect information and write it down. For example, in examination, precise writing. Because a few years back, I went for an examination in writing in Panchakarma diploma. Then one of my teacher and myself went together. And he failed and I passed because he only finished only 2 or 3 questions only. I finished, I only, it was a lengthy questions. I finished that to the most important points I underlined. And how you are writing, that is also very important. Then budgeting. Budgeting as in important planning, one must be able to evaluate factors such as availability time, marks prescribed for each test, tools required for the examination, etc. Budgeting. That means when there is a short note, 2 marks question will be there, 3 marks questions will be there, that 20 marks questions will be there. So you must have to divide. You must have to, if it is 3 hours, you must make it into 2:45, 15 minutes you must have to keep it back. So according to that, you divide, then definitely you are able to finish the questions. Otherwise, you may not get time to watch once more, and if some of the portions you may not able to write difficult questions, you must have to write last. Evaluation. Evaluating the knowledge accumulated and understand the change created by the new information comes under this category. Various test and examination ability to evaluate one's own learning proficiency with respect to time, day, week, month, knowing how to improve one's learning technique. Before that, not in the time of examination. Most of the time, what the people are doing, they will learn in the time of nearby examination. You cannot finish the portion, but you must have to learn little early, but you must have to again you must have to go for this, but the revision. Then only you can appear, and also you must have to read the points before, and you must have to write again and see that what it is. These are the some of the facts. Next slide, please. Next slide. In this scholastic backwardness, there are some points I like to mention in this scholastic backwardness, that the scholastic backwardness in the family, there is a school, and also the environment. There are so many factors are there that the scholastic backwardness, schools, environment, and the child, and even to the family, these are most important places there. It will affect the child. Here that you can see the family, that scholastic backwardness, one is left side is school and right side environment. Then it is, if the child is not the problem, the child is having a problem. Child is not a problem, it is most important. Usually people are telling the child is the problem. The child is not the problem, the child is having a problem. That is most important. The scholastic backwardness, the child, there first you must have to, left side you can see the psychological problem, and right side you psycho-educational problems, and the middle you can see the medical. So first let us see the psychological problems. Attention deficit disorder. That is the first that you mentioned, psychological. You must have to, what is attention deficiency? If there is time, I shall explain. Otherwise, the second part, if I may get opportunity, I shall explain in that time. What is attention deficiency disorder? Second one is ADHD, attention deficiency hyperactivity disorder. Next one is OD, obsessive disorder. Third one is CD, conduct disorder. Next one is ED, emotional disorder. PDD, pervasive developmental disorder. Then if you may go to the medical, there is a cerebral palsy. Then the general health, GH is general health. Then if you may go to the chronic illness, that is CI, epilepsy, that is the EP. Then if you can go to the next medical problem, that is a visual impairment, all these things also a child can have the problem. Then auditory impairment or speech impairment. OH means ophthalmic handicap. Sometimes the child, recently I treated a case with my neighbor, the child was not able to cope up with this class. So then they came and asked what is the problem. They thought that it is some learning disability. But when they checked, I asked them to check to this auditory and visual, that means ophthalmic problem, then there was power, and after the child is able to learn more, and now she is getting very good marks. The next one is LD, psycho-educational. LD means learning disability. Next one is MR, mental retardation. Next one is ESS, erratic study skills. Next one is POP, poor opportunities. Next one is ELS, erratic learning style. Next one is SL, slow learner. Next one, ESH, erratic study habits. Next one, BBS, poor basic skills. Next one is PRS, poor readiness skills. These are the problems of the child. The child is having a problem, not the child is not a problem at all. Next slide, please. These are the way we must have to study and to be study the learning these problems, how we can understand and study this way. It will be very important. Next one is scholastic backgrounds. What to do? First, we must have to see the child, consult a psychiatrist. If that psychiatrist is telling yes, then it is go to a medical checkup. Yes, consult a doctor. If there is psychiatry is telling there is a problem, then it can be a mental retardation. Yes. Scholastic backwardness, then it is medical problem first. Then if it is not a psychological problem, then go to a psychologist or a psychiatrist. Now homeopathy psychiatrists are also available. They can also treat very well. Then the next is the life skills. Then there is a problem, mental retardation, there are life skills. Along with our homeopathic medicine, you can try, it can improve. Even it is not 100%, definitely it can improve. If there is there is no problem for the MR, then you can go to the borderline intelligence slow learner, or it is a slow learner. Then you can go to the, if there is no, you can go to the LD, learning disability or dyslexia, calcula, etc. But I shall come to the next slide. Then if there is LD is there, that means learning disability or dyslexia is there, then you must have to go for 3C: concentration, coordination, and comprehension. This 3C is meaning for that. Then if another is that dyslexia, dysgraphia, and dyscalculia. These are the, dyslexia means for writing, and this dysgraphia is reading, and dyscalculia is by writing. These are the problems that usually the children are facing. So many dyslexia means reading, writing. Dysgraphia is reading, and dyscalculia is arithmetic. All these together is called dyspraxia. These are the problems that usually we may get in by learning disabilities. Then there is a if there is this learning disability is not there, then go to the RS, readiness skills. Then if it is also not there, go to SSS, study skills. If that is also not there, then go to the learning strategy. That is also, there is no there, then go to the poor opportunities, remediation and other things you must have to go for. These are the things that you must have to go. Now, next slide, please. Whether you can follow or not. Hello?
Yes, sir. Yes, no problem.
This is the definition of the learning disability. Specific learning disability means a disorder in one or more of all the basic psychological problems, more or psychological problems. 1 minute. Some of the pages cannot be seen. Yes. You can read, you can understand whether it can read completely.
Yes, sir. No problem.
Specific learning disability means a disorder in one or more of the basic psychological problems involved in understanding or in using languages spoken or written, which may or may not, or imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculation. The term includes such condition as peripheral disability, brain injury, minimal brain problems, dyslexia, and developmental
Yes, sir.
aphasia. The term does not include children who have problems primarily as a result of visual, hearing, or motor handicap, or mentioned emotional and disturbances or environmental, cultural, or economic disadvantages. This is called learning disability. That next slide, please. Here that you can go see that the child is having cold backwardness. There is a physiological or medical reason, and another is visual problem. Sometimes when we may see there is a visual problems due to the child cannot go up. Sometimes the disease epilepsy is another way. Problems, auditory impairment, cannot hear properly, cerebral palsy, general health issues, and chronic illness. These are some of the problems of the school children. Next slide, please. Who has this learning disability? The learning disability mainly dyslexia, that is for the reading. Then dysgraphia is writing. Dyscalculia is that the calculation problem. Dyspraxia is all together. It can come. These are the problems that we are facing. Next slide, please. It is mainly regarding the brain. That I think that mainly the people are already that they are gone through that. Most of the people may know all these things. Brain problems, but mainly left brain working in different way, and the right brain is also working in different way. Left side is critical or rational thinking is there. Right hand use math, numbers, recognize, sequencing, software, etc. Academic skills, reading, writing, arithmetic, spelling, language, scientific skills, listening and speaking, translation, classification, analyzing, statistics, critical thinking. Whether you can read or not, whether it is visible.
Yes, sir.
Okay. The right side, creative or emotional, that is the right side. Left hand use motor and mechanic, dance, music, appreciation, acting, mimicry, imagination, fantasy, storytelling, whether it can be seen properly, that is why I am seeing. Designing, crafting, building, sports, game, using map, piloting, navigating, perception, naming, art, sculpture, painting, cooking, homemaking, leadership, management, life skills, etc. There are, next slide, please. Hello. Here, this is the dyslexic normal brain, and there is a non-dyslexic brain. There is difference. By that, we can understand by scanning and the electroangiogram and etc. Nowadays, we can understand different methods. We can understand. Next slide, please. There are so many people. They were dyslexia people. They become so famous. They are, one is Einstein, that you can see this picture, that you know, everyone knows who is Einstein, and you know these people, most of the people that may know all these people, but most of the intelligent people were these people were dyslexia people. So I usually say that the dyslexia people may more intelligent, and they may get more, they may reach into very good places, that don't feel that they are not, they cannot absorb, but they can understand they are having special abilities. They may come into different categories and different places. They can come and come up into the life. There are people who are coming up so many ways that you can see that even there are so many ways they came up that we can understand. Whether it can follow, whether it is speed, whether it is some speed is more or less.
No problem, sir.
So, what is the first figure, please? Alfred Binet. Alfred. No, please, not seen that Alfred, that I can show to some other part it went. That you know Einstein, that Einstein is also having this problem. There are so many other persons also like that, of they were having the same type of the problem, but they became very famous. And page that I am not getting that page that I kept somewhere. And this part of multiple intelligence people, I can take the first. That there was usually we may talk about regarding to the IQ test, that in the Alfred, please show the Alfred Binet. He is in the French psychiatrist. He 1900 he invented that there is IQ test, and there are some other persons, Camin and Regular, 1992, Louis Terman and others also to contributed, and that is IQ. Nowadays, that the IQ test is again it is Howard Gardner has written authoritatively on multiple intelligence his book. That is, please show that the other part. Hello, please go to the next. That I shall come back. Yes, next. It is not there completely. Anyway, there are so many persons there. They become to the very much important people like that of Abraham Lincoln, Howard Gardner, and all these people are having different types of intelligence, multiple intelligence. The Howard Gardner invented verbal and linguistic intelligence. Example, Abraham Lincoln, they can memorize words, dates, and even correctly. They have the ability to explain, teach, and speak diplomatically, spelling errors, and rarely. Owing to all these abilities, they are usually classified as smart and studious. Celebrities like that Abraham Lincoln, Rabindranath Tagore, Kerala Pani, A.R. Rajarajavarma, Putti Krishna Maharaj, etc. are coming in that category. There are some like that of, you can see the Tagore and the C.B. Raman, Sir Isaac Newton, and etc. The logic mathematical intelligence was there with that the C.B. Raman. Then another one is that the Sir Isaac Newton. He was having also these thoughts, words, action, and after brilliant skills in observing and solving scientific and mathematical concepts. Scientists, researchers, engineers, economic experts, etc. Bankers, were so many personalities, astrologers, etc. They are become very famous. Celebrities like that Albert Einstein, C.V. Raman, Isaac Newton, Ramanujam, etc. are that. Then there are some people having musical intelligence. That is A.R. Rahman. You know, the A.R. Rahman became so famous. Then visual spatial intelligence. That is the Picasso. That you know the Picasso. You know very well. Then Bharathan, our Malayalam actor Bharathan is also coming under. Bharathan, Picasso, Van Gogh, Raja Ravivarma, and Marco Polo. They are there. Then interpersonal intelligence. This is the skill that helps to know the intention, aim, need, like dislikes, and convenience of others, and responded, etc. Gandhiji, Bill Clinton, Acharya Vinoba, Chanakya, etc. Interpersonal intelligence. The people have the ability to recognize their own skills and weakness. That you know, Confucius, Ramana Maharshi, Charles Darwin, etc. So many people are like
Yes,
that.
sir.
Okay.
Excuse
Now
me,
any
sir.
question answer is there? You can go come to the
Yes,
question answer.
time for discussion. Sir, is it convenient for you to have a session on 17th or 19th of this month?
I shall tell you later. So
Yes.
I must have to prepare some of the things that simply will be without
Yes.
preparation, I cannot do it.
Yes, if you are ready, then we can have arrange for 17th or 19th or according to your convenience. Yes.
No, I cannot. I joined for some other course. I cannot do it that time.
Yes.
That
Okay.
is
Okay. That's no problem.
okay.
So time for discussion. Those who would like to participate can go to the participant list and raise your hand. Anyway, even the topic was on the learning disability. I can see an extraordinary learning ability from your part, sir. That is most commendable work you have done. No doubt about that. Still studying, still learning, and still ready to share with all this to the participants. That's the most important thing. You have described about three to four cases. The first one is a Natrangar case, second one is Medornum, the third case was on sulfur. All are three different cases. The most important thing is you patiently took the case and appraised it and found the remedy. That's the most important thing. Then regarding the chart you present, there's a wonderful chart was there. The psychological aspects, then the medical aspects, then the psycho. The three portions are there. These things are very important. Looks quite interesting. Then how to manage the case. There was also a chart was there. So such type of charts as well as program scheduling is very important in almost all treating modalities. And I think homeopathy must also have to develop such protocols so that those who are taking the cases or going through this path can, without a failure, reach the right point. If anybody would like to participate, please go to the participant list and raise your hand. A lot of topics were discussed, a lot of cases, and so many wonderful terms you also described. So you said about the psycho-educational aspects. Sir, what about this ESS? What is that, sir? Will you repeat that ESS?
ESS.
Yes, sir.
ESS. Okay. Wait. I shall tell you. Psycho.
The psycho-educational section use what about this ESS, POP, ESH?
Yes, I shall tell you.
Yes.
Wait.
If you repeat that, that will be more beneficial for the participants.
What you said, ESS.
Yes, sir. ESS, POP, PBS.
In which chart are you able to locate that whether it is SP or family problem?
No, sir, the psycho-educational aspect.
Psycho-educational aspect. Okay. Psycho-educational, ESS.
Yes, sir.
Psycho-educational, ESS. That is erratic study skills. Erratic study skills.
Erratic study?
Skills. Erratic study skills. Skills.
Yes, okay.
SILS.
Yes, good, sir. Okay.
Erratic.
Then this POP.
POP.
Yes, sir.
POP I am not mentioned here.
Yes,
POP, poor
yes, sir.
opportunities, poor opportunities. Poor opportunities. Sometimes what happens in some of the cases that we may not having low income group people are there. Sometimes what happens, the houses there is a father may be drunkard, mother may be in a different types of some mental illness and such type of the problems in the house.
Yes.
That is the poor opportunity.
Then PBS, what is a PBS?
PBS, poor
Yes, sir.
basic skills.
Pardon?
Poor basic skills.
Poor basic skills. Okay.
Poor basic skills. That skills may not be for each and everything. There will be a skill. Even the class taking is also a skill. There will be must be some skills.
Yes, sir. Of course. You did good.
By natural or by repeating or by studying that you will
Yes.
get that.
Yes, sir.
Then
what about this?
You can get by birth.
Yes, sir. What about this ESH? ESH.
ESH. Wait. ESH. ESH, erratic study habits. Erratic. ERRATIC. Study habits.
Okay.
Erratic
Good.
study habits.
Then 3 more terms: SL, ELS,
SL.
then PRS.
SL means slow learner. What is PRS? Poor readiness skills. Poor readiness skills.
Yes. What about ELS?
ELS. ELS, erratic learning style.
Learning style, isn't it?
Style. Erratic learning style.
Okay, thank you, sir. Now it is Dr. Masrina from Malaysia. Dr. Masrina, please unmute. Yes.
Okay, thank you. Dr. Manoj, thank you. The SREEDHARA Kurup, thank you for sharing your cases. My question is actually not about learning disability, but someone who is actually very studious, maybe age about 20, very studious, but that has caused this person to be quite moody and also falling of hair, you know, like certain parts of the head, the hair is falling off. So what is your suggestion? I think this is because overthinking.
You know me very well. Earlier also you contacted me. You personally contact and send to the case record details. Simply, I cannot say. I must appraise and study properly. Then only I can prescribe. Extremely sorry. I am not a ready-made prescriber. I must
Okay,
study.
no problem, sir. I will
You
contact you.
contact me. You know my name and
Yes,
number
yes,
and
yes.
etc. That you are
Yes, sir.
discussing so many cases in earlier also. You can
Alright.
contact me and I shall deal with and discuss with you and study very well and I shall prescribe. Not now.
Okay, sir.
And,
Alright, sir.
I cannot do it like that.
No
People
problem,
are
sir.
there by hearing immediately they can prescribe. I need at least 2-3 days.
Yes, sir. Yes, sir.
Can prescribe,
Yeah, yeah,
immediately I can
and
prescribe such cases.
yeah, and
Earlier
thank
I
you.
was doing the two
Yes.
things you can do it. One is when you are not knowing anything, you can do prescribe easily. When you are knowing everything, you can prescribe easily. I am in between. That is
Alright, sir.
problems.
Alright, sir.
Learning more and more, it is very difficult. It is just like that yesterday somebody was telling like that of Marmani. When you may learn the Marmani, that I think that our what about his name? That our D. Silva was telling. Hubert D. Silva was telling.
Yes.
He was when you may learn more, you have difficulty to beat like that of when you may learn little more and more, you have difficulty to prescribe.
Okay, sir. No worries. Yeah, please.
Then you please take the case properly and send it to me. I will study and tell which is the medicine are coming with the help
Okay.
of the and medical.
Yes, sir. Of course.
Okay,
Yes.
sir. Thank you, sir.
Anyway, Dr. Masreen, if you can have some presentations, please inform Dr. Dhanesh. He will arrange a convenient date. We are also expecting from you from Malaysia.
no.
Okay. Yes.
Nowadays, you are not seeing at all into the meetings. Earlier, you are asking questions and you are participating.
Yeah. I'm quite busy now. Yeah, with other work. Yeah, that's the reason. Very sorry about that.
Okay.
Okay. Thank you, Dr. Manoj.
If anybody is there, like to have some. Now, Dr. Hubert is also very much the extraordinary learning person. Yes, Dr. Hubert. A special skill for
Hello.
Your mic is not there now. What happened?
How are you, sir? Very fine. Very nice presentation, and I am hearing it because with your energy, full-fledged energy and everything. So, Marmani.
You may learn more and you may not know. That is the problem. That I am in between. So I can't be between. I don't know everything and everything. That is the problem. I must have to learn with the help of the book and the repertory. And I compare between the medical, then only I can prescribe. I have no any stock medicines in my mind.
The most interesting and important thing is that our Sridhara sir is still studying at the age of 74. But unfortunately, a lot of young guys from different parts of our fraternity realize that you always promoting quackery and we are not at all using qualified persons. But unfortunately, they don't know who these persons are. They are highly educated, 5 times, 10 times than these who are young persons. They don't know, but they are just accusing that IFPH is promoting.
You don't mind when the elephant is going through the street, dogs may bark. But don't mind it, they may mark. Like that of you don't mind. Why you are worrying about these things?
Yes.
See, I am also a member of the IHMA lifelong. If they may send me out also, I am very happy. I am a secretary of ISK, that these things. I am a life member there also.
Yes.
So I am only a participant in this forum. Still I am telling, we must all be together and let them there in Bible it is telling, they don't know what they are doing. Let them to forget and forgive. That policy we must have to, what I feel, they will stop it one day. It is not, when you may mind it, definitely they will argue it, and then you are mentioned now. That is, otherwise I was not interested to mention, because I am a member of IHMA and I am a member of IHK. I am also coming every day, and it made me this much to talk, because that not only giving our experience, and we are also getting capacity made. What I feel, what the Dr. Hubert was earlier about 3 years back, not that the Hubert is now. What the Dr. Manoj is there, not the Manoj is not the now, earlier 3 years back, the Manoj is different from that. We are every day learning, day by day, and there are so many other persons. I am not mentioning all their names. What the our Danesh is, what he was clear. He was closing the eyes and talking. Now you see how he is talking with courageously. It is the experience makes the man perfect.
Yes.
So experience. So
Okay,
don't
sir.
worry about these things.
Yes.
That
There is no point of worrying, but I just mentioned because a lot of persons are not at all informed about the real situation. That is why I just mentioned, but deliberately. I am trying to wind up. May I invite Dr. Hubert De Silva to express vote of thanks. Dr. Hubert, please unmute. Yes.
A man of great wisdom, a man of great experience, a man of great enthusiasm. This I want to say about our SREEDHARA KURUP sir. He's always encouraging others. That is what when I performed the first time, I was very much depressed because my mic is not working, everything was not working. That time he encouraged me a lot. That time he consoled me. That is how he is making others becoming more and more. That is what we can see in our psychological uplifting of others. In his age, he is always enthusiasm, high enthusiasm. We must all follow him, because such a personality is always talking with very great wisdom and sharing experiences with wholeheartedly. That is why SREEDHARA KURUP sir is great. Sir, thank you very much for always you are in our heart. Thank you, sir. Thank you very much, sir.
Well,
same way, my heart also, you all are there. Thank you very much for giving me an opportunity. Sorry, because for 2 weeks, I may be from 14th onwards, 2 weeks, I am in a training. To be becoming more efficient and efficient for that purpose.
That's good. With that remarks, let me conclude today's English edition. Hope you to be the same day tomorrow. Till then, goodbye. And this is Dr. Shaila to continue the program in Malayalam.